Hi, welcome to the DME Update Training for December 2015. The topic of today's training is Medicare coverage of durable medical equipment. Durable medical equipment is medical equipment that's durable, right? So this is reusable medical equipment. Because of this definition that durable medical equipment, or DME, is reusable, there are certain things that are not considered as durable medical equipment. For example, adult diapers are not considered durable medical equipment because they are not reusable and therefore don't meet the definition as defined by Medicare. Medicare has conditions of coverage for durable medical equipment, and the conditions vary slightly depending on which piece of equipment. But generally speaking, for durable medical equipment, this must be prescribed for use in the home. Sometimes, so that a prescription is needed, it has to be used in the home. Sometimes for certain things like power scooters or power wheelchairs, a certificate of medical necessity is needed. And that makes sense because, you know, for Medicare coverage, in order for something to be covered, it has to be medically necessary. And when they say prescribed for use in the home includes a person's own home, or it includes a long-term care facility, but it does not include a hospital. Also, another condition of coverage is that the supplier must be a Medicare supplier. This is super important because if the supplier does not have a Medicare supplier number, Medicare will not pay the claim. Some suppliers will tell the beneficiary that if they, go ahead and pay the supplier out of pocket, they can submit a claim to Medicare and get reimbursed. That is not true. The reason is one of the conditions for durable medical equipment to be covered is that the supplier has to be a Medicare supplier. So if they break that rule, then according to Medicare, the person did not meet the conditions of coverage and it will not pay. So just be very aware of that a supplier must be a Medicare supplier in order for Medicare to pay out. The next few slides list some examples of durable medical equipment. For durable medical equipment, this is covered under Medicare Part B, is subject to the Part B deductible, and then after that deductible has been satisfied, a person would generally pay about 20% of the Medicare approved amount. And if they have a supplement or an employer group or a retiree health plan, then that supplement would oftentimes pay that 20% copayment. So some examples of durable medical equipment would be air fluidized beds and other support services, blood sugar monitors. So if somebody's a diabetic and they need to test their blood sugar, that monitor and associated supplies are covered under Medicare Part B. So those test strips that go into the blood sugar monitors are covered. Canes are covered, but if somebody needs a white cane for the blind, that is not covered. A commode chair is covered. A CPM machine is covered. Crutches, hospital beds, infusion pumps and supplies are covered. Manual wheelchairs, and then also power mobility devices. And what the power mobility devices are, the scooters or electric wheelchairs. Those are covered. Nebulizers and nebulizer medications are covered. So if somebody, this is really important, if you're talking to somebody during Part B season and they give you a drug list and they say, oh, they have albuterol, for example, and that albuterol is for their nebulizer, Medicare Part B, the medical insurance will cover that nebulizer medication, not the prescription drug plan. Oxygen equipment and accessories are covered. Patient lifts are covered. CPAP machines, suction pumps, traction equipment, and walkers are all covered under durable medical equipment. The list goes on. There's more than just this. To see if a specific item is covered, you can go to Medicare.gov, type in that specific item, and an article will generally pop up saying how that specific thing is covered. When we're talking about durable medical equipment, something that's closely related to that is prosthetic and orthotic items. Orthotics are covered, and usually those are things like orthopedic shoes and different braces and whatnot that may help somebody mobilize. And then prosthetics are defined as replacing a body part or function. So when we're talking about orthotics, we're talking about orthopedic shoes or arm, neck, and back braces. When we're talking about prosthetics, we're talking about artificial limbs and eyes. If somebody has a mastectomy, any artificial breast, even a surgical bra is considered a prosthetic. Ostomy bags and certain related supplies are considered a prosthesis because that ostomy bag is replacing a body part. Urological supplies are covered as a prosthetic, cochlear implants. Also, more broadly, prosthetic devices needed to replace a body part or function. So things like pacemakers are considered a prosthesis. And then therapeutic shoes or inserts for people who have diabetes or who have severe diabetic foot disease are all covered under that prosthetic and orthotic item. And again, with this, it's a 20% co-payment of the Medicare approved amount after that Part B deductible has been satisfied. Most people who have a Medicare supplement, that supplement would pay the 20% co-payment. And then finally, corrective lenses. Corrective lenses are considered prosthetic lenses, and this would be if somebody needs glasses after a cataract surgery. Also conventional glasses and contact lenses after a surgery with intraocular lens. And then the intraocular lenses themselves are all considered prosthetic devices. So if somebody has had some kind of eye surgery, many times that is covered. And I should say eye surgery to fix a disease or condition of the eye. So LASIK surgery is not considered medically necessary, right? It's not considered to correct a disease of the eye. Rather, it's considered to correct a vision impairment, which is considered differently under Medicare's rules. So that's kind of generally about how DME prosthetics and orthotics are covered. There's a couple of special situations that arise that I wanted to kind of talk about in more detail. The first would be the power wheelchairs or scooters. There's a little bit more scrutiny for getting a power wheelchair or scooter. It has to be doctor prescribed for use in the home. A face-to-face examination by a physician is required in order to get a power wheelchair or scooter. And then there's a whole fact sheet, which is in the link at the bottom of the slide, that lists specific mobility limitations and what the thresholds would be. For example, if somebody needs help with 3 activities of daily living, that might be a condition to get a power wheelchair. So there's a lot of different scenarios. The fact sheet kind of goes with them in more detail. But simply put, in order to be eligible to get a power wheelchair or scooter under Medicare, there has to be a mobility limitation. The person cannot be able to operate a manual wheelchair, and it has to be prescribed for use in the home. With power wheelchairs and scooters, it's a rent-to-own situation in most cases, where there would be a 13-month rental, and after that 13 months, if it's still needed, then the person would own that device. So what happens if a piece of durable medical equipment gets broken? Well, it depends on, either way it gets fixed, but how it gets fixed depends on whether it's rented or purchased. For DME that's rented, Medicare pays that supplier a monthly rental payment. And what's included in that monthly rental payment is that the supplier covers the repairs. That's part of the terms and conditions of that contract between the supplier and Medicare. So if it gets broken and the thing is under that rental period under Medicare, that piece of equipment is repaired and the supplier covers the repairs because Medicare is already paying them. If the piece of equipment is purchased, then person would still be able to get that durable medical equipment repaired, but Medicare will pay for the repairs, and there would be a 20% co-insurance in most cases. So either way, a person should still get their DME covered, and it would either be covered by that supplier under the rental agreement or by Medicare. Now oxygen is considered durable medical equipment, and the rules for oxygen are a little bit different. So it's a 36-month rental for oxygen equipment. And after the 36 months, the provider must provide equipment and supplies for the oxygen equipment for an additional 24 months. After that 5-year period, a person becomes eligible for new equipment. Now, if the person decides that they want to keep their old equipment after 5 years, that's fine, but there might be problems with getting oxygen if the old equipment is retained. So really, after that 5 years, once somebody becomes eligible for the new equipment, they should probably have Medicare, provide them with that new equipment. When the equipment is under that 36-month rental period, the rental payments include all the equipment supplies, accessories, maintenance, servicing, and repairs for the oxygen equipment. So these would be things like the tubing, the mouthpiece, the oxygen contents, all of that is included in that rental payment. And then, of course, for the oxygen, there is a 20% co-insurance that the beneficiary is responsible for. Now with oxygen, there's some problems that have arisen, and they're pretty common. One problem would be if the oxygen equipment doesn't allow the person to move around the home or is no longer effective. Well, Medicare wants the oxygen not to be a limitation. So if the oxygen equipment is a barrier or is not effective anymore, then the doctor can provide the oxygen supplier with a new letter of medical necessity. And Medicare would pay for some new equipment because the old equipment is no longer meeting the person's needs. Another problem would be oxygen supplier will no longer supply liquid oxygen. If that's happening, then the person needs to get something in writing from that supplier and then call 1-800-MEDICARE to complain. The supplier wants to change the terms of the contract, they're not allowed to do that. So they can't do that unless the doctor makes an order change. And if a person is unable to resolve it with the oxygen supplier, they can call 1-800-MEDICARE to complain. Another thing that happens is that the oxygen supplier goes out of business. If that happens, the supplier must provide 90 days notice in writing and help find a new supplier. And that, in the real world, that may or may not happen, but that's the requirement of the supplier. Another thing that's pretty common is a person moves. So if somebody moves from one location to another, if it's during the 36-month rental period for oxygen, then they need to find a new supplier that's going to be local and, be able to provide them with the oxygen and the equipment for the oxygen. The old supplier can help, or 1-800-MEDICARE can help. If it's after the 36-month rental period, it's the supplier's responsibility to ensure that the person has coverage. So the supplier is mandated to help the person find a new oxygen supplier. Where, like, during the 36-month rental period, it's a suggestion that the supplier helps. After the 36-month rental period, it's a mandate that the supplier helps. So that's kind of it about durable medical equipment and the ins and outs of specific devices. Really, oxygen and the power wheelchairs are the two sticky wickets. The other thing to be aware of that comes up a lot is the nebulizer medication, like I mentioned, is covered under Medicare Part B medical insurance, not the prescription drug plan. Also, infusion pumps. So if somebody has a diabetic pump, the insulin for the diabetic pump is covered under Medicare Part B medical insurance, not Part D. Those are kind of the common things to be aware of. The other thing I want to make you aware of is this idea of Medicare competitive bidding. This has been something that's been going on for a few years, since January 2011, and it's for certain durable medical equipment, prosthetics, orthotics, and supplies. So there's a round 1 and a round 2. One of the things that happened in July of 2013, and some of you may remember this, is the National Mail Order Program for diabetic supplies was implemented, and this is when if somebody was getting their diabetic test strips from a mail order, they had to use one of the mail orders that were selected as part of the competitive bidding process. The reason that Medicare moved to competitive bidding in certain geographic areas of the country is because it limits fraud and abuse in the Medicare program. It also helps people with Medicare save money and get better quality equipment, supplies, and services. So how this process worked is suppliers submitted bids to Medicare to provide the MePos, durable medical equipment, prosthetics, orthotics, and supplies at lower prices than Medicare was paying. So the idea is that they were, there was competition that was driving this, and through competition there would be better prices, better quality. All contracts were awarded to winning suppliers to sell or rent the MePos. So not everybody that was a supplier that was in a competitive bidding geographic area was able to remain in the Medicare program. There were some losers and some winners. The winners, they could still sell the MePos, but the losers, those people had to notify their clients in writing that they were no longer a Medicare supplier. And so what we've seen in the past is when this had happened, that they would get letters, and the letters were confusing, and people would think that they could no longer get their durable medical equipment, period, when all they had to do was change suppliers. The amount Medicare pays for the MePos is based on the bids. So if the bid was less than the Medicare approved amount, then the co-insurance would be less too. So if the Medicare approved amount for a walker was $200, the provider was able to provide the walker for $100, it would be 20% of the $100 that the beneficiary's coinsurance would be. Contract suppliers must meet eligibility, quality, and financial standards and be accredited by an independent organization. So there were higher quality metrics for these competitive bidding suppliers. In most cases, only contract suppliers could bid. And even though there was this process, the types of items didn't change. It was just the coverage and the amount of money that would be paid for each item. So there's a lot of kind of technical information about this competitive bidding program, and some of it really isn't for our constituency. Really doesn't matter a lot of the behind-the-scenes stuff for our beneficiaries. Really, where the rubber meets the road, here is what you need to know. The competitive bidding process, as a result of that, there are fewer suppliers, but there are still several to choose from. So instead of having hundreds of suppliers for a particular piece of medical equipment in a specific geographic area, you have lower numbers, but we're still talking, depending on that piece of equipment, 20 to 50 suppliers. So it went from hundreds to a more manageable number. To find a supplier in somebody's area, just go to medicare.gov/supplier, and you can enter in what type of medical equipment is needed and the person's zip code, and poof, there will be a list. Remember, for Medicare to pay for a piece of durable medical equipment, a person must use a Medicare supplier. And be aware, there are some suppliers that lost the Medicare competitive bidding process that have confusing messaging, either through letters or through the information that their customer service representatives tell their constituents. So under round one, there's a recompete product that's kind of in the middle of its cycle. It was January 1st, 2014 through December 31st, 2016. The products that are included would be any respiratory equipment and related supplies. This includes oxygen, CPAP, respiratory assist devices and related equipment, and the nebulizers. Also included is standard power mobility equipment and related accessories, so walkers, standard power and manual wheelchairs, scooters, and related accessories. Home equipment, so hospital beds, group 1 and 2 support surfaces, so things to help prevent bed sores, TENS devices, commode chairs, patient lifts, and seat lifts. Enteral nutrients, equipment, and supplies were covered under this. Negative pressure wound therapy pumps and related supplies and accessories, and then external infusion pumps and supplies were all covered in round one. There's going to be a recompete for round one in 2017, so stay tuned for that. Again, it shouldn't be really anything different for the beneficiaries. There just might be different suppliers, January 1st, 2017. Round two competitive bidding will expire June 30th, 2016, and the program expanded to 91 metropolitan statistical areas. So products included in round two were the oxygen, enteral nutrients, CPAPs, RADs, hospital beds and related accessories, walkers and related accessories, support surfaces, standard power and manual wheelchairs and accessories, and then negative pressure wound therapy pumps and related supplies and accessories. So changes from round one to round two are those items that are in bold or italics. The other thing that was included in this competitive bidding was the National Mail Order Program for diabetic testing supplies. This was designed to ensure that people with original Medicare continue to get quality supplies and save money. People who choose to have diabetic testing supplies delivered to their home need to participate in one of the National Mail Order suppliers. So if somebody goes to their corner drugstore to get their diabetic testing supplies, this has nothing to do with that. It's just for those people who got their diabetic testing supplies through the mail. And there's only a few different suppliers, again, somewhere around 20 to 30, depending on where somebody lives, mail order suppliers for the diabetic testing supplies. There's a 20% co-insurance for that as well. So competitive bidding program, who's effective? Well, anybody who has original Medicare and lives in a competitive bidding area is affected. And in the metropolitan Detroit area, we are a competitive bidding area. But to see if we are in a competitive bidding area, if you were, you can always go to medicare.gov/supplier, hunt for a specific supplier, and then it will list, you'll see, does the supplier accept assignment, and, does the supplier participate in the competitive bidding. Medicare Advantage plans, they're not overtly impacted by the competitive bidding program. The Advantage plans, who's ever under contract with the Advantage plans would still be the Advantage plan supplier. So this is really just for original Medicare. The mail order program for the diabetic testing supplies, that expires on June 30th, and so there is a round 2 recompete that will become effective July 1st of 2016 and expire on December 31st of 2018. So stay tuned for that. So doctors and other treating practitioners and their use of contract supplier, they must almost always use the contract supplier. Items and services are included with the competitive bidding program of the person with original Medicare lives, or if somebody is traveling to or visiting a competitive bidding area. So they have to use the contract supplier. Certain items can be obtained without being a contract supplier, like walking or folding manual wheelchairs, and a nursing facility can supply directly to its own residents only if it becomes a contract supplier. A consumer can stay with a current supplier that doesn't have a new contract, provided that the supplier elects to become grandfathered in. So there's a whole grandfathering process in order to kind of become legit. The person with original Medicare must permanently reside in the competitive bidding area, and the person with original Medicare was renting certain equipment or oxygen when the program started. So if the supplier doesn't want to go through that grandfathering process, the person can't get it from that supplier. For grandfathering, a non-contract supplier must inform Medicare consumers in writing about whether they'll continue renting equipment or not, and they must work with a contract supplier to get new equipment if Medicare consumers wish to switch to the contract supplier. So the choices would be either to switch to the new contract supplier or to continue getting services from the grandfathered supplier. So that's only if that supplier goes through that grandfathering process. If somebody has other insurance, Medicare may make a payment to a non-contract supplier if required by a primary policy. So if Medicare is secondary. The non-contract supplier must be accredited, have a valid Medicare billing number, and be eligible to receive secondary payment. So there's a changing supplier scenario for obtaining the MePos items from a new contract supplier. Mildred's permanent residence is in Miami, which is a round 1 competitive bidding area. She currently is renting her CPAP device from ABC Company, which has a 2016 round 1 recompete contract, but not a 2017 round 1 recompete contract. Mildred receives a notice from ABC Company informing her that they won't be a contract supplier and that they also won't be grandfathered. Mildred must transition to a round 1 recompete contract supplier for Medicare to help pay in this situation. If somebody's traveling, a person can get information on whether that area is a considered bidding area on Medicare.gov/suppliers. A person must generally use a contract supplier for that competitive bidding area. Specific brands, if somebody wants a specific brand of durable medical equipment, the doctor must prescribe it in writing and the medical record must reflect the need. And then the contract supplier must provide a specific brand or form as prescribed and work with the doctor accordingly. And if they don't have that item themselves, they have to help locate another contract supplier that can meet that need. We already covered the equipment repair and replacement. So, it depends if it's rented or purchased. Generally speaking, durable medical equipment is covered at 80% by Medicare after the Part B deductibles are met, and a person would have a 20% coinsurance. If there is suspected overpayment or fraud, then the best place for a person to call is the HHH Office of the Inspector General, and their number's in the slide. Some points to remember: the competitive bidding program does not affect which doctors or hospitals a person can use. It's just where a person can get their durable medical equipment. Generally, a contract supplier must be used for Medicare to pay, and a person with Medicare may be able to stay with their current supplier as long as that supplier is grandfathered. And then this competitive bidding process really doesn't have anything to do with Medicare Advantage, and that Medicare Advantage plans, a person would still need to consult with their Advantage plan to see who's on contract with their Advantage plan. So on these slides are 2 links for some great publications. The first is the Medicare coverage of DME publication. If I'm being honest, the first half of this presentation was stolen right from that publication, so it's a really great source of information. And then the DME repair and replacement fact sheet has more information on that topic if you need it. That concludes our training. Thank you so much for watching. If you are watching remotely, please let your site coordinator know that you did so that you receive credit for this. If you have any questions, you can also direct them at the site coordinator or myself. Thanks so much and have a great day.